Lindsay Nungaray. I'm going to be doing, as part of one of my classes, online classes, I'm going to be doing a physical assessment, or sometimes referred to as a head-to-toe assessment. Let's see. I'm going to be dealing with a patient by the name of Carlos. He's going to be my model today. The setting is an outpatient clinic, and he's an overall healthy individual, 35-year-old male, and he's just coming in for an employment physical today. And so let's get started. Okay, we're going to be entering into a private room, okay, because this is what I have to work with. So anytime when you're going to go ahead and do a physical or head-to-toe assessment, you want to make sure you provide privacy, which I would, and also wash your hands. So I'm just going to go ahead and do that first. Okay, and then I'm going to come and greet my patient. So here we go. Knock, knock. Hi, Carlos.
How you doing?
My name's Lindsay. I'm going to be your nurse today. I'm going to be doing your head-to-toe assessment or your employment assessment today.
Okay.
Can you verify your name?
Carlos Nungaray.
Okay, and your appointment time?
3 o'clock.
Okay. The reason why I asked him his appointment time and to verify his name is just so that I can make sure that his level of consciousness, that he is alert and oriented to person, place, and time, which he is. So I'll begin. So I'm gonna go ahead and I'll be talking to him most of the assessment, okay? So you guys can just watch, but I'll be talking to him, mainly asking him some questions and doing an assessment on different parts of his body and different systems, okay? So Carlos, I'm gonna go ahead and ask you some questions, okay? Are you okay with that?
Yes.
Okay, and then I'm gonna be touching you at times, so are you okay with that?
Yes.
Okay, I'm just gonna ask you to remove your hat. Okay, and we'll go ahead and begin. So the first thing I wanna do is I'm just gonna assess your head, okay? I'm gonna just feel on your head, and I'm just checking for any lumps or abrasions. I'm looking and seeing if there's any patches of hair that's missing, okay, because that could signify an abnormality. Carlos, everything's normal in that area. Next, I'm gonna go ahead and ask you to shrug your shoulders up, Carlos. Good. So by doing that, I went ahead and assessed your cranial nerve number 11, okay? It ties into the muscles of the shoulders as well as the neck, okay? I'm just looking at you, checking the setting of your ears, okay? Make sure that they're symmetrical and, everything's equal. I'm gonna go ahead and touch your ears, okay? I'm gonna go ahead and grab my pen light, and I'm checking for any drainage, okay? Do you have any pain when I do that?
No.
Okay, good. Okay, and I'm gonna go ahead and do the same thing on the other side. Good. Okay. Let's see. Next, I'm gonna go ahead and look at you. I'm gonna use this pen light, and I just want you to look at this light and follow it, okay? Good. So what I'm checking for is perla, okay? Pupils are equal and reactive to a light and accommodation. I'm also gonna check his 6 cardinal fields of gaze, okay? So what I want you to do, Carlos, is look at this. Okay, I'm gonna be putting this in several directions. I want you to follow it with your eyes, okay? So here we go. Good. Okay, do you wear corrective lenses? Glasses?
No.
No? Okay. So everything looks good. We don't have a Snellen eye chart here, but if we did, I would go ahead and check his vision, the acuity, using that. Okay. So he doesn't wear corrective lenses, so overall it's a normal assessment on the eyes. Okay, next I'm gonna check his mouth. So Carlos, I'm just gonna ask you to open your mouth for me. Okay, I'm checking the sides of the cheek. Okay, make sure that the mouth is pink and moist and no bleeding or sores. Go ahead and stick your tongue out for me. Okay, now up to the roof of your mouth, the tongue. Okay, and side to side. Good. And one more time, open. Say ah. Say ah for me. Good. Okay. I'm just checking for some symmetry of the uvula and also the cheeks, the inside of the mucosa. Okay. Everything seems normal there. Okay. Let's see. Go ahead and look up for me. I'm checking his nose. Any problems with smell or bloody noses or anything? No. Okay. Go ahead and cover one nostril and breathe in. Okay, I'm just listening to see if I hear any type of obstruction or anything in the nose. And go ahead and do that to the same side, the other side. Good. Okay, and I'm checking the nose for symmetry. Okay, everything seems normal there. Do you have any pain here?
No.
No? Okay. And on this side? Good. Okay, so that seems all good. Next, we're going to go ahead and move on to the respiratory system. Since he's on this position, I'm going to go ahead and take a listen to him. I'm looking for respiratory effort as well as the depth, the rise and fall of his chest. Okay, so we'll go ahead and get started with that. When you feel my stethoscope on you, touch you like this, go ahead and take a deep breath in and out. Okay, not too fast, just breathe normally but nice and deep. Okay, here we go. Okay, and one more. Good. Okay, so his lung sounds are clear. Okay, I don't hear any wheezes, nothing abnormal there. And the rise and fall of your chest was normal and standard. I'm going to go ahead and come to the back of you and I'm going to listen again, okay? Okay, deep breath. Again. Again. Almost done. And last one. Good, and again, the same thing. Breath sounds are clear. Any pain here?
No.
No? Okay. I'm just feeling his spine. Looking for any lumps or abnormalities. Okay, good. Okay, Carlos, I'm gonna go ahead and listen to your heart. I just want you to breathe normally. Okay, by the way, respirations are 18. Okay, regular rate and rhythm, okay? I'm gonna check, let's see, heart sounds, so I'm gonna start with aortic. Okay, that's at the right side of the second intercostal space. And moving on to pulmonic, which is left second intercostal space, left. Herb's point, left third intercostal space. Tricuspid, which is left lower sternal border, and that's at the fourth intercostal space. And finally the mitral. And that's fifth midclavicular line. Okay, so I'm going to go ahead and listen for a full minute. Okay, and Carlos, so your heart rate is 76, and it's a normal rate and rhythm. Okay, I don't hear any abnormalities or extra beats. I'm gonna go ahead and check your carotid pulse. Okay, one at a time. This is really important. Good, and now the other side. Good, and temporal pulse. Okay, radial. So I'm doing them both at the same time just to make sure that I don't, nothing's off and everything's about at the same rate. Okay. And then you have your femoral, which is right at this area, and then the popliteal, okay? But I'm just gonna check the dorsalis pedis right at the top of the feet. Okay, and the posterior tibias, right at the inner. Okay, good. All right, so next we're gonna go ahead and move on to, oh, sorry, I forgot something. So, let's have me take this on. So while I'm down here, I'll just check for capillary refill, and I'm checking for any edema. He seems fine. And capillary refill, I'm gonna push down on his nails for 3 and make sure and check if it returns, which I do, less than 3 seconds. Sorry. It's okay. Okay, so next we're gonna go ahead and move on to musculoskeletal, okay? You can put your shoes on. So, Carlos, I'm gonna go ahead and have you assess I'm gonna have you assess, go ahead and squeeze onto my fingers. Okay, a little bit harder. Good. I'm making sure that his strength is equal on both sides, okay? I'm gonna ask you to pull my hands apart, okay? So with your hands, you're gonna try to pull my hands apart. Go ahead. Good. And then you're gonna try to close my hands. So here, and try to push. Good. And you're gonna push towards me. Good. Okay. Again. Okay, good. So go ahead and stand up. I'm just gonna have you walk just to the door. Okay, you're gonna go 1 foot in front of the other. I'm assessing your gait, okay, the way you walk, and I'm also assessing your balance. So go heel toe. So like this. Heel. So. Okay. Okay. and go ahead and walk that way, staying on your toes. And then you're gonna come back and you're gonna go on your heels. Good. Okay, so stay standing. I'm gonna have you bend down and touch your toes. Good. And stand up. Go ahead and step out one step. There you go, right there. Okay, and I'm gonna have you just bend with your knees like if you were gonna pick something up. Good, and up. Good, okay. Go ahead and have a seat. So the last part, I'm gonna have you actually lie down. Okay, you could remove your shoes. I'm gonna set your hat here. And I'm just gonna assess the GI system, so your gastrointestinal system, okay? So I'm gonna listen to your abdomen. I'm gonna start at the left lower quadrant, and I'm checking for bowel sounds, okay? Good, I'm gonna be moving clockwise. And normally you wanna listen to for 15 seconds, okay? Okay, and Carlos, you do have active bowel sounds in all 4 quadrants. I'm gonna go ahead and ask you to raise your knees up. Good, and I'm gonna just feel on your tummy. Go ahead and tell me if you have any pain. Relax your head. Okay. Okay, and tympani present in all 4 quadrants as well. Do you have any problems with your bowels? Do you have a regular bowel pattern?
Yes.
Okay, and urination, no problems with that? No. Okay, so lastly, you can sit on it. I'm just gonna take some time at the end of the assessment to go ahead and educate him, okay, on a few things. You're overall healthy, so, you know, I just encourage you to drink fluids and bend with your knees when you're at work, and, you know, use your proper body mechanics, save your back and also your knees, and then just regular physical activity and a balanced diet, okay? Make sure you keep up with your yearly physicals, okay? And if you notice anything abnormal, you're gonna wanna call the doctor, okay? At this time, I'll go ahead and let the doctor come in to see you.
All right.
Thank you.
Thank you.
Have a good one.